Good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Task Force to give you the weekly pandemic report for April 9th, 2021. The task force has two objectives. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. There are several interventions taking place right now to combat the transmission of COVID in the Coastal Bend community, which right now the chances of transmission are high. According to the nuecesknows.com risk dashboard, you can go to nuecesknows.com/risk dashboard to get more information. To combat the spread, you're encouraged to get vaccinated. That's the best thing that you could do right now. 2, avoid crowds, wear face coverings and social distance, isolate when you're exposed or symptomatic. And there's partial to all remote schooling that's taking place presently. Okay, we have 42,258 total confirmed cases in the Coastal Bend up through this week. That goes right all the way back to the beginning of the pandemic. I want to remind you that a confirmed case is one that is confirmed with one of those swab tests that they stick pretty far up your nose, or one of the other tests combined with a physician's diagnosis. Of those, there have been 40,387 recoveries, and presently there's only 634 active cases, which is down 15% from last week. And the reason why I say only is because we've been up in the thousands for most of the fall and the winter, and we've dropped down to just hundreds, but it'd be nice if this number was even lower than the hundreds. So hopefully this trend continues and the cases decline as they have over the past week. Right, so each week we show you our transmission rate estimation, and there's a high amount of uncertainty this week. The transmission rate looks like it could be anywhere from 0.8 to 1.1. If the transmission rate is 0.8, what that means is that for every 10 people that contract COVID, they'll pass it on to an additional 8 people in total. So from 10 to 8, that's a decline. But what the 1.1 means is that if you have 10 people that contract COVID, they'll pass it on to an additional 11 people, and that's COVID spreading. So right now we're not sure whether we're expanding or contracting in terms of COVID. And I'm showing you the reason why here. This is how we calibrate the model. The black is the number of weekly new cases, and the orange is the simulated number of new infections from the model that we run. If we look at the long term, then we have a very nice fit with the 1.1 to the data. But that doesn't capture this last week of declining numbers of cases. If I fit to the declining number of cases, that's what gives us this 0.8. So that's why we have some uncertainty this week. Like always, as we get more data, we'll be able to determine whether there's a longer term upward swing here or if that's over and we're really headed downwards. In terms of number of new cases per day, this is what the data looks like. Each point is the actual number of reported new cases per day in the Coastal Bend, and then over here you see we have our projection lines, our upper projection in orange and our lower projection in blue, and you can see where they fit fairly well to the data that has occurred already. So the projection is that whether it increases or decreases, it's going to remain fairly similar to where we're at now. That's at least what we're projecting. Now, if we dig into this data a little bit, in Nueces County, we have age-based data, and the thing that I see here is that in the 18 to 39-year-old age bracket, there's a very distinctive increase in the number of cases over the past month or so. And so even if for 40 to 64-year-olds it's staying even, 0 to 17-year-olds looks like it's declining now after an initial increase. 65 to 79-year-olds declining and 80 plus declining. We still have that being offset by one of the more populous portions of our community, the 18 to 39-year-olds, increasing. And so we'll keep following these trends, but hopefully this upwards trend stops and it starts curving downwards rather than some of these other trends curving to match that 18 to 39-year-old age bracket. If we dig into the data another way and show each county, you can see that in Nueces, the number of new cases per day dropped over the past week. For San Patricio, they only report once a week, so it's hard to say whether they dropped or increased, but say from their last reporting, they certainly increased. Now we'll see today from their new reporting whether it's a further increase or it stays about the same or it declines. But there are other counties that have increased. Jim Wells, B, Brooks, and this is Duval down here, have all experienced an increase over the past week. Clayburgh has stayed about the same, and Aransas has dropped, kind of like Nueces has. So we have mixed signals occurring in the coastal bend. When we look across the state, there's also a little bit of mixed signals, with Amarillo taking up the lead right now with a distinctive curve upwards in the number of new cases. But here in South Texas, we're headed downwards overall. And the same thing is true in Houston, whereas in Dallas and Fort Worth and Longview, they're kind of leveling out, maybe a little bit of an increase there. And then San Antonio and Austin heading upwards. So again, mixed signals locally, mixed signals across the state. Okay, looking at the number of COVID patients in our hospitals in the coastal bend, the black dots represent the census number of COVID patients counted each day. And last week we had leveled off, but there's been another decline over the past week from the last time we talked. And depending upon our projection scenario, whether we're actually increasing or decreasing, you can see the expectations that we have for how the hospitalizations might change. Something I've been pointing out over the past couple weeks is that we've had developed this difference between the model projection and the number of people in the hospital in a way that indicates that there's more people being admitted to the hospital with COVID than in the past, given the number of positive cases. And this can happen for a few reasons. I'm starting to think that the primary reason is that decision making has changed slightly, and maybe there's a little bit more room in the hospitals right now, and they're admitting more people with COVID than was occurring back in November, December, and January. And one of the reasons why I think that that's the case, or the evidence that I have for that, is that the plot like this for the fatalities doesn't match this. The fatalities match the projection very closely. I was speculating that this difference could also be driven by an increase in the number of new variants and the cases attributed to the new COVID variants in the area. But in addition to those possibly driving higher hospitalization rates, they're also potentially going to drive higher fatality rates, and we're not seeing that same difference. So this seems to be something that's due to decision making and a human phenomenon as opposed to a viral phenomenon. Okay, moving forward, looking at the number of people in the ICU, we had an increase last week, but then this week we've had a decrease in the number of COVID patients in the ICU. We're down to 17, and if you look back, we haven't seen this few COVID patients in the ICU since early fall, late summer. So that's a good sign, and we have 142 non-COVID patients in the ICU, which is pretty close to the long-term average number of people in the ICU in the coastal bend prior to the pandemic really taking off, which means that people that need ICU care but don't have COVID are getting it in the coastal bend. So this is just like the last graph, but for every trauma service area in the whole state. So this is the last graph, just a lot smaller. And if you look at this very quickly, you can see there's either declines or leveling off in the number of COVID patients in the ICUs across the whole state. If you want to look a little bit more closely, I encourage you to pause the video. This graph is very similar to the last graph, but it only shows the last day. And the last day of data that I have is April 7th. And the blue represents non-COVID patients in the ICUs, and the red represents COVID patients. I think this is a pretty good indicator of stress that's being applied to the ICUs by COVID, where the more red you see, the more stress that's being applied. And right now, these panels look pretty blue. So blue sky panels, low amounts of pressure on the ICU by COVID, and this is something that we hope continues. Okay, moving on to fatalities. We've been seeing a decline and maybe a leveling off of the number of new fatalities per day, where each one of these points is the number of reported new fatalities per day from the coastal bend. And depending upon the transmission rate, our projections are either for a slight increase or slight decrease over the next month or so. Overall, there are 7 more people in this 1,237 than we had last week, so 7 more people from the coastal bend have died from COVID-19. These numbers come from the state. They count death certificates. Sometimes it takes up to 14 days for the death certificates to be processed. So we're essentially looking at the number of fatalities as reported probably 14 days ago. Moving on to vaccinations. And we've seen these numbers of vaccinations creeping up this week, and this week we're at about 21% in Nueces County. It's 21% of the population has been fully vaccinated. Over the whole coastal bend, anywhere from about 15-16% in Live Oak to 32-33% in Kennedy County have been vaccinated fully. Zooming out to look at the whole state by trauma service area, the coastal bend is one trauma service area, and you can see that we are in second place in terms of having the highest proportion of our population vaccinated. Last week we were in first. This week the Laredo area has pulled ahead slightly, and hopefully this will change in the next week. Remember that there's going to be a vaccination station at La Palmera Mall across from Grimaldi's, and there are also vaccination clinics that are upcoming at the American Bank Center and other locations. Go to cctexas.com to find out information and get vaccinated. And here's why I have a little bit of concern. Last week, when I got vaccinated, I got my second dose last week, I was able to walk in without waiting in any lines. There wasn't one person ahead of me. They scanned my QR code, I sat down, they stuck a needle in my arm, I walked to a sea of empty seats in the waiting area, and then I left. And that made me nervous that maybe the demand for vaccinations is slowing down. And so what I'm showing this week is the trend in the new vaccinations that are occurring from February to present, and my gut feeling is confirmed here, where we're seeing the demand for vaccinations slowing, and the number of vaccinations that are being delivered is slowing down. So this pattern is driven almost completely by demand, because there is supply for vaccinations to keep occurring at the same rate that they have been. And so we strongly encourage everybody that if you're eligible to be vaccinated, to do so, and don't wait or put it off. And the reason why is because the quicker that we all get vaccinated, the quicker this is over. And if I were to project this out forward in time, I don't foresee it ever reaching 80%, which is the goal that we have for the local community. So if you want to get vaccinated, now's the time. It seems like the lines are short, and you can have it minimally impact your everyday life. Last thing, we'll look at the cell phone metrics, and indeed the spike in activity that we saw a few weeks ago was due to spring break, because since spring break has ended, we've seen a decline in non-essential visits, distance traveled, as well as a decline in encounters, kind of back to about 25% of normal. Normal is defined as the values that these metrics had in February of 2020, which is before the pandemic really started here in the coastal bend. At least it's before anybody realized that COVID-19 was present in the coastal bend community, and our behaviors hadn't changed yet. So in terms of non-essential visits, we're getting pretty close back to normal. And that's a little bit concerning, but at the same time, if you're wearing a mask, then a cell phone can't pick that up. And you can make non-essential visits and still be safe. You can travel long distances and still be safe. And some of the proof is right here in the encounter data, because people are avoiding encounters much more than they were in February of 2020. You can see it's a big difference, about 1/4 the amount of encounters between cell phones now as 1 year or a year and a couple months ago. Okay, so in summary, the transmission rate is between 0.8 and 1.1. That means that we're not quite sure if it's increasing or decreasing. And it's incumbent upon us, the things that we do here in the community will determine which of these is the more correct transmission rate. Hospitalizations and fatalities are declining or leveling off, depending upon which of the metrics that you look at. The cell phone metrics that measure factors associated with transmission of COVID-19 are dropping after spring break, so that's a good sign. I want to remind everybody that even though I didn't run the scenario or show you the run of the scenario this week where what happens if we take off our masks, you'll have to trust me that simulation still shows that if we try to go back to normal, that there could be another major outbreak in the coastal Bend area. We need more people to be vaccinated than have been vaccinated right now to really control the spread of COVID. So you're encouraged to stay vigilant and get vaccinated if you can. Whether you have or haven't been vaccinated, you should wear face coverings. And if you only have a surgical or a cotton mask, double them up. Do the surgical plus the cotton mask. That gives you like a KN92 rating out of the KN or N95 scale, which is pretty darn good. Continue social distancing. Multi-household celebrations are discouraged, even among people that have been vaccinated right now. And we've talked about this. I'll reiterate that as an evolutionary biologist, I can't think of any easier way to stimulate the evolution of a strain of COVID that's resistant to vaccines than to vaccinate a bunch of people and then expose them to COVID. Remember that there's still plenty of COVID out in the community right now. The positivity rate is around 14%. And if you've been vaccinated, you don't want to be exposing yourself to more COVID and becoming the new patient zero for a vaccine-resistant strain of COVID. So continue wearing your face masks. Eventually, when enough of us have been vaccinated and the background level of COVID in the community is low enough, we can take off our masks with confidence that we won't be triggering the next outbreak. All right, thank you very much for your time. I want to remind everybody that we welcome your questions and comments about the task force and about the COVID pandemic. Our handle is at CBCovid, which stands for Coastal Bend COVID. We're on Facebook, Twitter, and Instagram. You can post questions. We'll address them on Fridays on our Facebook live stream at noon. It'll be myself, the Public Health Director, Annette Rodriguez, as well as Tiffany Anderson and Jason Lewis from the task force. We'll happily answer all your questions. You can also save your question to give us a gotcha question live. We're always excited to get live questions and interact with the Coastal Bend and try to give you the best information that we can. So thank you very much, and we'll see you next week. I hope everybody has a safe and enjoyable weekend.